Welcome to Between Two Ovaries, your go-to for all things women's health.
A lot of people just say like, oh, my vagina.
Yeah.
And
Yes.
that's
all
not,
of the above.
That's not your vagina.
No.
Well, it is.
We're here to cut through the confusion, bust some myths, and give you the facts straight from the experts.
You cannot still believe the amount of people that come to a gynecology clinic saying that they don't look right down there and they need something doing about it.
We're keeping it real, bringing you honest conversations about topics that matter to you.
Everything goes back to the menstrual cycle. Yes, it's a low-risk procedure, but it's not a no-risk procedure.
From periods to menopause and everything in between, we've got you covered.
So whether you're here to learn, laugh, or just listen, you are in the right place.
As soon as I said it. So, welcome to our episode all about abortions. We thought it was really timely to discuss this topic because we've not touched on it yet in any of the other episodes that we've done. So we've called this Right Place, Wrong Time, Abortion Explained. So abortions or terminations are done for many reasons. Wrong timing of pregnancy, failed contraception, fetal abnormality, carrying a pregnancy would be dangerous for the potential mum-to-be, and this is just to name a few situations. And we don't judge regarding terminations, and we always ensure that we give best care.
Yeah, and it's become quite a political topic. It's been in the news a lot lately, basically because America has kind of gone backwards. So Trump has driven profound restrictions on abortion care by overturning Roe v. Wade and getting rid of the constitutional right to abortion care, which means that each state can then make its own mind up about whether they allow, restrict, or completely ban abortions. And that's led to a lot of women being really, struggling in situations where they don't want to be pregnant, and it has led to a lot of difficult decision making for each state as well.
It's like crazy because it's actually like going back in time. It feels as ridiculous as like, I don't know, taking the vote away from women or like saying that women can't
You're not allowed to work.
I know, or saying you can't work or can't do certain jobs.
Yeah.
Like you can't decide this. This is like, it's just a monumental thing that
Well, it's just
being
politicians should not be making decisions about women's bodies for women. It should be women themselves or healthcare professionals that they ask to give them help with.
And I think, like, whatever you believe about terminations, because everybody's going to have a different situation, a different belief with terminations, but there are going to be certain situations whereby I think everybody would be able to see the benefit of a termination if a baby had got anencephaly, so it's not kind of developed a brain or a head or that kind of thing. Like, this baby's not going to be able to survive. It's dangerous for the mum. It's dangerous for the baby. Well, it's dangerous for the mum massively to have this pregnancy. And we're saying that no one can have a termination.
Yeah,
it's
horrible.
just
It makes no sense.
no, it's crazy. Like
Yeah.
absolutely crazy.
But also, just to like completely digress on that topic, you're right that there's situations where no one should disagree that a termination needs to happen, like if the baby doesn't have a brain. But at the same time, women should be allowed to decide if they don't want to be pregnant at any time in their lives. There are certain gestations that it's allowed up to, which we'll go into. But there was a podcast with Lily Allen and Mikita Oliver. Did you hear about this?
I did.
So Lily Allen and her were talking about how many abortions they've had. And I think Lily Allen was like, oh, I don't know exactly how many I've had, maybe 4 or 5. And Mikita was saying that she's had quite a few and then got the coil, and the coil helped her not get pregnant by accident. But they made a really good point. They were like, it shouldn't be a shameful thing for anyone who's had a termination to talk about it. It's not just for if you've had a medical problem or the baby wouldn't be normal.
Yeah.
It should also be like acceptable for you to make a decision that you don't want a pregnancy at a certain time.
Definitely.
But again,
Right
I just
place.
went right off on a tangent.
No. But right place, wrong time.
Yeah.
I totally get it. And these situations need discussion and they need normalising. I don't believe that termination is a form of contraception because there are lots of contraceptives that people can access freely. So I think people should have that open discussion. But a termination can happen for so many different reasons, and sometimes contraceptives just don't work. And there can be lots of different reasons. So we thought this was very important, and I really do believe this. And with regards to this kind of changing in abortion rules and otherwise, there's an estimated 25 million unsafe abortions occur every year. 25 million. And making it one of the leading causes of maternal mortality and morbidity worldwide. So abortion-related deaths and morbidity are largely preventable, obviously, but because by providing safe abortion care and timely post-abortion care, because so as early as possible in a pregnancy, as well by access to contraception and comprehensive sex education, could stop these from happening. And it is it's like genuinely taking a step back in history, what happens to some people now. And with America, with the new ruling, it totally feels crazy.
No. And it doesn't need to be unsafe. So we know that actually the kind of risks and problems that can come from terminations are much lower than if you allowed those women or forced those women to go through those pregnancies and have those children. They're more likely to have problems with childbirth and pregnancy, which are more damaging to their health than if they'd have had a termination that they wanted at the beginning.
And we know that most terminations in the UK occur before 21 weeks, so like 98%, so most. There's a proportion that occur between 20 and 23 weeks, that's 1%, and then less than 0.1% of all abortions occur after 24 weeks. And after 24 weeks, these are usually because of a severe abnormality with the pregnancy or a risk to the mum's life. So I think people get really kind of het up on that people are having abortions, terminations, and we're killing babies that would be alive. And actually, we've just told you, like, on the whole, these don't happen later on in pregnancy. They're happening much, much earlier on in pregnancy.
Yeah. And on the flip side of America, the UK has actually made quite a lot of progress in decriminalising abortion.
Which we like to see.
So since June 2025, I think it's now formalised or maybe very close. Women will no longer be arrested or investigated if they have a termination beyond the gestation, well, at any gestation. So this is because by law, the Abortion Act says that you can have a termination if it's for, we're going to go into this a little bit later, but generally it should be less than 24 weeks unless there are special situations, which we'll go into. And that led to some women being prisoned for having a termination when they thought that they were earlier than they were in the pregnancy. So, for example, Nicola Parker was a high-profile case. She was arrested. She did go to prison. She thought she was about 6 weeks pregnant. She took the pills by post, which, again, we'll go into what that is, but termination pills. She took them at home and then delivered a 26-week stillborn baby, which would have been incredibly traumatising.
Yeah, you don't need prison after
At
that.
home, which is also quite risky to your life as well. You could bleed,
And
there
what
could
we're
be
like
all
is,
sorts of problems.
Oh, we'll probably in jail now.
Yeah, and then she gets arrested and goes to jail.
God.
Luckily now she's been acquitted, she's out, but that was one of many
So
kind of high-profile
traumatic.
cases that...
When was...
That was...
In COVID?
A few years ago.
So-
Yeah, not long ago, no. So now that wouldn't happen, but it's only recent. And the whole point of it is these women are often vulnerable women in difficult situations. They might not know they're pregnant, or they might be in a violent relationship and not want to admit that they're pregnant until they can actually get the care that they need. And we should be looking after them, not arresting them, sending them to prison. So it is there's progress in the UK, even though it's gone backwards in America.
So if you found yourself pregnant and you didn't want to be and you didn't want to keep the pregnancy, what would you do?
So the first thing is we need to kind of work out how pregnant you are. So we've kind of discussed this before. You can determine how pregnant you are from the first day of your last period. So from the first day of your last period, you add on to where you are now. So at your missed period date, you are 4 weeks pregnant, and every week after that, 5 weeks, 6 weeks, as so on and so forth. Sometimes people don't know how pregnant they are, and if that's the case, then they probably need to have a scan to work out how pregnant they are, to see kind of what's the safest situation for themselves.
Which could be like if you don't have regular periods, if you're on contraception that's not worked, or if you have PCOS and you have irregular periods, it's quite common to not know how many weeks you are if you weren't expecting to be pregnant.
But actually not all people will need a scan if they want a termination. If you know how many weeks that you should be and you have regular periods and you're pregnant, then you can access abortion care without having a scan. You would need a scan in certain situations, so if you had pain or bleeding, because then we're thinking about it could be a pregnancy in the wrong place, and that kind of obviously it didn't matter if you wanted to keep the pregnancy or not. If it's a pregnancy that's an ectopic pregnancy, so a pregnancy in the wrong place outside of your womb, then that's not a pregnancy that can continue. It's a pregnancy that can be quite dangerous, so we would need to treat you for that, so you would need to be seen.
And we have a whole episode on ectopic pregnancy, if anyone's listening that hasn't listened to that one yet.
But treatment for an ectopic pregnancy doesn't count as a termination.
No.
Yeah, just so we're clear on that one.
Yeah, no, that's a big myth. It is not true at all.
Doesn't count as a termination.
That's treatment for what could be a life-threatening condition.
Yeah. And it's also very different treatment. So if you have got pain and bleeding and have gotten the pills for an abortion and you're at home and you're like, well, I'll just take these because that will be fine, it won't be fine, and you do need to seek medical help.
It won't
with that.
work.
No.
Yeah. We should also probably just say as well, the pills by post thing came about during COVID.
Yep.
So before
Okay.
that,
Always
if you
have a
wanted
scan.
to have a termination or an abortion, you always had to go in and have a scan. But then obviously during COVID, no one could get into hospital safely to have a scan. So we didn't want women to not be able to get terminations. And so a lot of amazing people worked really hard to get this pushed through government, and now you're able to get pills by post if you are less than 10 weeks pregnant without having a scan, and you can have a safe
And they've
termination.
carried
at
that
home.
on after
Yeah.
COVID.
Continued it, yeah.
There are some good
Which is
things that
brilliant.
have come out of COVID.
Yeah.
That is definitely one of them.
Yeah.
Yeah.
Because if you can do something at home rather than coming in,
Yeah.
it's handy.
Oh yeah, definitely. So abortion is legal up to 24 weeks of pregnancy, usually if two doctors decide that this is a good idea for you, which they are trying to change, I think, because they're saying, why do two doctors need to decide that something is a good
Yeah.
idea for one woman when they've decided that it's a bad idea for them? But anyway,
Okay.
and then at least one of the following must apply. So the pregnancy hasn't exceeded 24 weeks and it continues to pose greater risk to the woman or her family's physical or mental health than a termination would.
Which is what most abortions are done under that criteria. So, yeah.
All of the other criteria are you can have done at any time of a pregnancy. So that would be it's necessary to prevent grave permanent injury to the physical or mental health of the woman. The continuation of the pregnancy would endanger the woman's life. There is substantial risk that if the child were born, they would suffer from serious physical or mental abnormalities. Now, those ones, there is no upper limit to those. And obviously, again, it's a discussion, and it's not if you've decided that you don't want this pregnancy when you're 30 weeks pregnant, you can't just walk in and say, I've decided actually I
take
don't
this
want
back.
this pregnancy
Yeah.
anymore. It would have to be that there was a serious problem. Yeah.
And I think we should also say as well that sometimes you don't know there's a problem with the pregnancy until later on.
Yeah.
You might already be beyond 24 weeks when you have a scan that shows an abnormality with the baby that would mean it wouldn't survive beyond birth.
Yeah.
And so these things, you need time to make these decisions, and that's why
Yeah.
the law is set that you are
for
able
those
to access
situations.
medical care in those
Well,
situations.
things take time. So if you've had your what everybody says is like a gender scan at 20 weeks, which is 100% not a gender scan. It's a scan to check for any abnormalities.
Yeah.
So if you have your scan, your anomaly scan at 20 weeks, that actually could be 21, 22 weeks.
Often
if like
is,
we're
yeah.
running a bit late. So you've had
on the
that
waiting
scan
list.
then. And then they've said, oh, we think that there might be an issue, but we're not entirely sure. You need an amniocentesis, so we need to get a sample of the water around the baby. So you get booked in for that. Then that is sent away. Then
wait
that
for
takes
the
a couple of weeks to come back.
Yeah.
You can see how time can just snowball really very quickly for them to make a decision there. Because it is a massive decision.
Yeah.
Life-changing.
Because at this point, when you're kind of 24, 25 weeks pregnant, you're invested in this pregnancy.
Yeah, you're
It's
like,
not a
wait,
pregnancy.
It's going for
Yeah.
changes.
Yeah.
You've decided that you're having a baby.
Yeah.
So then for you to kind of flip round and for you to be told that the pregnancy is not viable, like the baby's not going to live when it's outside of you,
Yeah.
or if there's a chromosome problem and that's going to relate to X, Y, and Z, then there's a lot of issues and a lot of discussion that needs
A
to
lot
be
to
had.
take in.
Yeah.
Yeah.
It's not going to be something that's going to be done overnight.
No, and then also we're going to go into what happens when you have a termination. So we're going to go into medical and surgical, but those kind of later gestation pregnancies, we're not really covering that today. That's a little bit of a separate thing. But as we mentioned at the beginning, as Nick said, they're 0.1% of terminations or abortions.
So we're covering most of them.
Yeah, and they're really necessary, and taking that away from women and their families is just an awful thing to do. To force someone to carry a pregnancy when they know that baby's not going to survive. If they don't want to, that's torture, isn't it? Like,
Yeah.
And on the flip side of that, some people do want to carry the pregnancy to term whether they know it's going to survive or not. And in these circumstances, and I know we are totally digressing at this point.
It's important though, I think,
But
to cover
Cover all
and
bases.
in these circumstances, the paediatric team, so the baby doctor team, and the obstetrician team, so the doctors that look after the mum, will have loads of talks. They have big meetings that then kind of works out where you want to be.
Yeah.
So where you want to be when your baby's born. There are palliative places that you can take your baby to. You can take your baby home. So we need to have all this discussion, and it's not like we just wait till you go into labour and then be like, oh, okay, we've seen
Now
there's a scan
what?
of it.
Yeah.
This
No,
is
it's a
all
lot of
planned.
care. Yeah.
Yeah.
But the majority of terminations in the UK happen before 24 weeks.
Yes.
And I would say the majority happen for that first clause, which is because continuing the pregnancy would cause harm to the mum, her physical or mental health, or her existing children.
Yeah.
And a lot of them happen, even though most do up to 24 weeks, most will happen a lot earlier than that as well, mostly in the
Way
first
less than
trimester.
12 weeks.
Yeah.
Like way less than
And
12
Way
weeks.
less.
At the 24 weeks, I know there's obviously anomalies, but will most people, if they've not planned to get pregnant, will most people know that they're pregnant by 24 weeks?
Most people would know that they're pregnant, but some people do get further along in pregnancies and not realise they're pregnant. It's a small number of people, but you do hear these stories because they're quite interesting, aren't they? The people who go into hospital with a sore tummy and then come out with a baby.
Isn't that like
the
a whole
stories
TV
are out
show in
there.
America? I didn't know I was pregnant.
Yeah, I mean, it's an issue everywhere because for some people it might be that they knew but they couldn't admit it and they were hiding it, or for other people it might be that they genuinely never
Didn't
knew.
know.
But those cases are really, there's not many of them. Yeah.
So with this, we keep saying like women. I don't identify as a woman at age 25. Like I'm still a little girl. So like, do you have to be a certain age to have an abortion? Is there like, over 18s?
No. You don't have to be a certain age, and it all goes down to Gillett competency rule. So if you're over 16, you can consent yourself to have an abortion. If
Okay.
you're less than 16, but you're deemed competent,
Okay.
as in you can understand the ramifications of anything, you can kind of understand what you're signing for, you have not been coerced into something, and you are kind of sensible from that side, then you would be able to sign and say that you would like to go ahead.
And that would be a situation where you wouldn't be sent pills by post.
And I hasten to add, you would be kind of not pushed, but you would be advised that it's a really good idea to speak to people around you.
Yeah.
So like whether that be your mum, dad, sister, brother, friend,
Yeah.
mum's friend, auntie, anybody, like you don't want to do that on your own.
Because most of the time, those people will care more about you being safe and having the right care than being angry at you for being pregnant by accident.
Yeah.
So it is a really hard decision to make, to tell someone, but you will be encouraged to do that if you seek medical advice about a pregnancy in your early teens. Yeah.
And so we said at the start that obviously there's a lot of different opinions that people have on this matter.
Yep.
If you're a doctor and you're involved in that area of work, or a healthcare professional, do you have to be involved in abortions?
No. So you can. Hang on, I'll start again. So you can conscientiously object to being involved in the care of a woman, in providing termination services to women. But what you can't do is refuse to care for women if there's, say, a complication. Say you're a gynecologist, you're not involved in giving women terminations, but you are on call when a woman has had a termination and is bleeding heavily. You have to then care for her because that would be life-threatening.
Yeah.
And it's linked to a termination, but you can say that you don't want to be involved in providing terminations.
So you can conscientiously object, and that just could be for a religious reason. It could be for a you just don't believe in them reason. It could be for any reason. And that's fine because it's very like a separate stream of healthcare. So just you can be just not involved with it.
Yeah.
Okay. So if you've, found out you're pregnant, it's not for you, you've decided that you are going to go ahead with the termination, what actually happens? Because I feel like we talk about terminations, but like what's actually happening there?
Yeah.
What's going on?
There's two types broadly. So we've got medical and surgical. So we'll go through medical first and then surgical. So medical terminations are what they sound like. We give you medication and then that encourages the pregnancy to pass and stop growing. These are the pills by post abortions, but you can have them in hospital as well. So if you're less than 10 weeks pregnant, then you can, and if you want to, you can have pills by post, which means that you have a phone consultation, they'll send you the pills in the post and you deal with everything at home. You can opt to do this in hospital, but there will be certain situations where we would recommend you do it in hospital.
So if you're after 12 weeks, usually you get advised to have a medical termination in hospital.
Okay.
Just purely because it's a bit riskier, isn't it? So you're more likely to bleed or for there to be potentially more pain and potentially some problems.
We used to do pretty much all medical
hospital.
Terminations in hospital.
Yeah.
They used to come in for like on a day ward.
Okay.
With miscarriages or terminations, kind of to be treated with the medications and kind of stay in until they pass the pregnancy, but that's just kind of not the case at all.
No, it's changed a lot.
Yeah, mostly at home
Probably for the
now.
best.
Yeah.
Can I ask a question here that's going a little bit rogue?
Yeah.
So the pills by post are for a termination. are different to Plan B, sort of like emergency contraceptive pills. Okay.
Yeah, emergency contraception is very different to termination. That's like, they're not the same thing at all.
Yeah.
So when you take emergency contraception, you're not pregnant. So what you're doing is you're delaying ovulation, so that if you've had sex and there's sperm, you're not giving it the chance to meet the egg and get pregnant. So you're not pregnant when you use Plan B.
Stopping yourself from getting pregnant.
It doesn't work if you've already ovulated, which we've talked about. And in that situation, you would need to get a copper coil. That would be the only thing that could work.
Yeah.
But this is totally different. So the drugs that you use for terminations are called mifepristone and misoprostol. There's two. So you take mifepristone first. It's an antiprogesterone, which basically stops the pregnancy growing. And then 24 to 48 hours later, you take misoprostol, which is a prostaglandins that helps the uterus contract to expel the pregnancy.
Okay.
So they work together.
Yeah.
Is it always successful?
No.
So
Unfortunately not.
we will go on to complications, but let me just quickly go through the process of what happens. So you have the mifepristone, then you have the misoprostol 24 to 48 hours later. We know that if you are further on in your pregnancy, your body is more receptive to the misoprostol, so sometimes you need different doses.
Okay.
So that's why we kind of have this cut-off of 12 weeks, and different people will need different doses. And we also take into account whether you've had caesarean section or not, because we want to make sure that we're looking after that womb for future pregnancies, if that's what you desire. So they're all things to be taken into account. But once you have decided that you're having medical management, this hopefully avoids surgery. But there are pros and cons to each, and I don't think when I counsel patients about this, I'm like, there's not a great option. Like, there's not a this is the best option for you.
Yeah.
It's a kind of what fits with you, what you would like to try, because they're not kind of foolproof and don't work for everybody either. So with the medical management, you take your tablets, but there's no kind of, you're going to take your tablets and 4 hours later you're going to pass the pregnancy. Doesn't work like that.
Yeah.
You might pass the pregnancy between the first tablets and the second tablets. You might pass the pregnancy for an hour after the tablets. You might pass the pregnancy 2 days after the tablets. So there's really no kind of answer to this. And if you were someone that had more than one termination, both terminations might be completely different as well. So it's kind of making people aware that actually we haven't got a prescription of at hour 1 this will happen, you will start bleeding, at hour 2 you will start with cramps, at hour 3 everybody is so different. So you're going to have cramps in your tummy because we're giving you medications for you to have cramps in your tummy. And you're going to have bleeding because bleeding will happen when the pregnancy passes, and it's not just a heavy period. If you're 8, 9, 10 weeks pregnant, you will pass kind of pregnancy tissue.
What does that look like?
Well,
It
it
can look
looks different for
variable.
different people.
Okay.
Sometimes it can look like a sac. Sometimes it will just be kind of like a clot that wouldn't disintegrate.
Okay.
So it, again, can look really very different for different people.
It can look, so if you're more like 12 weeks pregnant, you can see a fetus as well. And I think it's really important people know that. It's very small, a few centimetres, but if you're not prepared and you see that, that can be really shocking.
Yeah.
So some people will see that, but most people, as Nick said, it'll be heavy bleeding, blood clots, and then maybe some kind of tissue or like a jelly-like sac, that kind of thing.
Yeah.
Okay.
So I think people just need to be aware that you're going to have medical management. This obviously avoids surgery, but we don't know how long it's going to take. You're going to have some bleeding. You might see some pregnancy tissue. You might see a tiny fetus. You're going to have cramps in your tummy. And so there's things just to be aware of so that people aren't kind of like, oh gosh, what's going on? What's going on?
It's a scary thing
You
to
want to
go
be as
through.
prepared as possible.
Yeah, I
right?
think so.
Yeah.
And also, the gestation you are doesn't tell you how much you're going to bleed either. Like, it's more likely that you'll bleed heavily if you're a later gestation. But with your uterus, if there's something sort of like stuck in your cervix or stuck in your womb and not coming out, then you can bleed around it.
Oh.
So you might end up bleeding a lot, but actually have a very small pregnancy. So say you're 6 weeks, you might think, oh, I'm not going to bleed very much. But you can actually bleed a lot more than you're expecting. So it's always good to expect a lot.
There's definitely not again, a plan. So you can't do this the 24 hours before you're going to go on holiday. You need time. Need to have a bit of time. It's not like a quick fix.
Yeah.
If you took the first medication and you passed the pregnancy before the next
second,
one.
yeah.
Would you take the second set or not?
Sometimes you wouldn't need to, but what you would do if you're doing this at home, you would have numbers for somebody to contact and you would speak to somebody, because everybody's going to be quite different. They're quite specific about what have you passed, how much have you bled. If you've spotted and filled a couple of pads, then you've probably not passed the pregnancy. So it's kind of a discussion. But sometimes some people would not need the second part, and most people would need it. But I think, again, if you're going to do it at home, have as much knowledge as possible. Be aware that you potentially could pass after the first. So don't take the first tablets and be planning something.
Don't do anything in between.
Night
Sit down and watch some Netflix. Don't
Agree.
Take care
have
of
someone
yourself.
with you.
Is
look
there
after
like
yourself.
a limit of, because obviously you said different people bleed different amounts. Is there a point where it's like, right, this is when you're bleeding too much?
So if you're bleeding and you've got a proper size pad, because some people are like, I've got a panty liner on, and you're like, we want you
is
to
gonna
have
do
a bleed. You're going to pass a
you need
pregnancy.
more
A
than
panty liner in a thong is not going to. It's just not going to be the one. So if you're passing and you're filling pads, like if you're filling a pad every half an hour, then we need to see you. So you need to be seen in an emergency room, whether that may be A&E or you might have a walk-in early pregnancy unit, whatever you've got. You would be given advice as to where to go, depending on the timing or that kind of thing. But yes, that can happen, and that is a complication. And it's a complication that can happen that would mean that maybe you might have to go straight to theatre, because if you're bleeding heavily, if there's pregnancy tissue stuck, then we would potentially take you to theatre and just remove the pregnancy tissue to stop you from bleeding.
Okay. And you said about pads, but I assume you can't wear a tampon?
No, you're advised not to wear a tampon until after the bleeding has finished, which can take several weeks. Just because there's a risk of infection.
So just pads.
Just pads.
Yes. So complications, obviously, we've just touched on bleeding, and sometimes people can bleed very heavily. So they need to be seen. Like, don't be sitting at home thinking, oh, well, they said I can bleed.
Not that much.
Not that much.
And as well, if you have severe pain or dizziness, anything like that. So it might not just be the bleeding that means that you don't feel quite right. You should have a number that's been given to you to access if you do need emergency care.
So you said before, does it work on everybody? No, it doesn't work on everybody. And there are some people that it won't work on, and they will continue with their pregnancy despite taking the medications. As we said, though, that everybody is kind of told what to do in certain situations. So if you haven't bled after the second tablet, then you'll probably be given a third tablet, which is the same tablet as the second tablet, so misoprostol, basically just some more misoprostol. But if that still hasn't worked, then they will probably ask you to come in for a scan and then decide what to do next.
How common/uncommon is that?
So I always say kind of it can be up to 1 in 20, but the guidelines that I've looked at, because obviously we all do a little bit of reading before this, I've said 2 in 100. So it's rare, but it's not like when we see...
It's not no one.
It's definitely not nobody. There's quite a lot of people that...
But it's more likely to work than not work. Which
Yeah.
is the
Oh yeah, definitely.
good thing
We're
about
more
sport,
likely to work.
Yeah.
But surgical and medical terminations aren't 100%, and I think that's what people need to be aware of.
Yeah.
Infection can happen, but again, very rare to happen actually after medical termination. Severe bleeding is very uncommon, but we need to see you sooner rather than later if you're bleeding. And rupture, so that means like your womb tearing while it's inside you, is very, very uncommon to happen, and it's usually in people that have had a cesarean section and they're further on in their pregnancy. So these are people that
They wouldn't be at home
would have
anyway.
had more.
Would that be on a rupture on the scar from the cesarean?
Yeah, but it's not on your skin. So it's like on the scar of the womb.
Right.
Yeah.
But it
'Cause
can
I think-
happen if you've not had a C-section as well. It's just less. It's more likely if you've
likely.
had a scar on your womb because it's weaker there.
I assume that's a lot of pain.
Yeah.
You would know that that's
There would
happening.
be.
I'm not sat at home not knowing.
No, you would be in a lot of pain. And as we said, like if you've got a lot of pain or if you're bleeding a lot, come in and see somebody.
someone,
Seek medical advice.
Yeah, it's always best to check if you're not sure about something, rather than sit at home and worry about it.
So there's some people that can't have medical terminations.
Okay.
So if you've got pain or bleeding, then you need a scan, because if you've got pregnancy in the wrong place, as we said before, if you've got an ectopic pregnancy, we can't just give you the medications for a medical.
We'll see that quite a lot. People who've been to the termination service who have then said, "Oh, I've got a little bit of mild pain," and they're like, "Well, we want to make sure it's not an ectopic," so you might end up being sent for a scan in that situation. Usually, if it's mild pain, we wouldn't be worried, but we'd always scan and check anyway.
Yeah, we always want to know
Better to be
that
safe
it's in
than
the right
sorry.
place.
Yeah.
Definitely. If you have had an allergic reaction before to any of the medications, because you've obviously got to be able to take the medication.
Fair enough.
Yeah, which is not that common, I don't think. I don't know anyone that-
No, but some people, if you've got severe asthma,
Yeah.
these medications would be contraindicated.
Okay.
And if you have a couple of other medical conditions, and also if you have a bleeding condition, it might be that you can take the medications, but you would need to do it in hospital.
Right.
Okay.
So discussion would need to be taken place. So make sure when you're telling people any history that you tell us all of the history, so we can do
It's
this
all important.
as safely as possible.
Yeah. So under 10 weeks, you can get the pills by the post,
Okay.
which it basically means you don't have to go into hospital to have the care of the termination. If you were more like 10 to 12 weeks, we'd probably recommend that you come in. Well, we would recommend that you come into hospital 100% to have the termination, because it's more likely that you might bleed or have some pain, and then you're in a safe environment where you can get medical care. And up to 24 weeks, you can have medical management or medical termination of the pregnancy. Again, anything above 10 weeks, you would be advised to come into hospital.
Yeah.
Okay.
And with regards to this, there is no lower limit.
No.
So if you are pregnant and you've got a positive pregnancy test and you're not bleeding, then you can seek abortion care straight away.
Okay.
We would prefer that you were treated earlier
Sooner
rather than
rather
later.
than
So don't sit at home and think it's going to go away.
Yeah.
It's not.
They don't.
No.
I know that, again, it's different for everyone, but would the effects of the medication be less if it's sooner?
It's really difficult to say, and the chances of it working and all that kind of stuff actually can be different for different people.
Yeah, but they're still very effective
And you don't
if
even
you're
know,
6 weeks
you don't know
pregnant.
what it would have been later
No.
if you've not done it.
No.
And these are the same medications that we use for medical management of miscarriage. So say you're 6 weeks pregnant and you have a scan and you're diagnosed with a miscarriage. You have the same medication, and it works well then. So it's I wouldn't say if you're 6 weeks or early and you're not sure if it'll be effective, I'd still give it a go if you try it, if you're considering it. Yeah. It's more likely to work than not.
You will be offered pain relief. Take the pain relief.
Yeah.
You're going to get cramps in your tummy, and when people are like, oh, it's just like a period. It depends what your periods are like. If you're like, oh, well, I don't get any pain with my periods, I'll be fine. It's not going to be true, is it? Because you're going to we're causing you to have cramps.
Yeah.
We're causing you to be able to pass a pregnancy. And so you need to take
Have some
pain
painkillers.
So
Take
we're-
them before you take
Yeah.
the misoprostol.
So we're causing contractions.
Yeah.
This might be a rogue question, but is that going to be like the equivalent to a contraction if you were actually at term and in labour?
It's more like a cramp, like
Okay.
a severe,
A strong cramp.
Yeah.
menstrual cramp. If I was
Okay,
looking for the
okay.
word, rather than a contraction.
Okay.
Yeah.
But it is the same muscle in your uterus.
Yeah.
So not just with the bleeding and the pain as well. We didn't mention that misoprostol can give you diarrhea.
Oh, lovely.
Because it also stimulates your bowel as well. And a lot of people, I think 1 in 10 get diarrhea, but it's probably more, to be honest.
Yeah.
And you can feel quite sweaty, shaky. You can vomit as well.
Oh.
So, it's not a nice situation. Make sure that you are kind to yourself, have someone there with you. Take pain relief before you take the misoprostol so that it's working by the time you start.
And there's no complications with taking pain relief?
No,
at the
not
same
with
time?
the methylmiso. No.
And by pain relief, are we
Together.
like paracetamol?
Yeah, like paracetamol, ibuprofen, a hot water bottle, a bath, like anything that you think that relieves pain is a good
before
idea.
you comfortable.
Yeah. I think although we've kind of said that it's not the most pleasant thing, you're still avoiding a surgery.
Yeah.
And I think that is a massive thing to do.
Yeah.
And a lot of people will be like, I'll just have surgery. That means it's over and done with and it's finished. But actually that's not the case. It doesn't work for everybody. And you're having a surgery. We're instrumenting your womb. We're putting instruments into your womb to remove a pregnancy. So if we can avoid that, that is a good option.
Yeah.
So we're really not trying to put people off
Yeah.
medical management of abortion at all.
Yeah.
I can see because people will think surgery, oh, I'm under anaesthetic, I won't feel it.
Yeah.
But there's obviously
So much more.
complications,
Yeah,
which
there's
I
risks
assume
with
you're
that.
gonna tell us
Yeah.
about.
Yeah. So with regards to pain management, just the last thing is obviously if you're further on in your pregnancy, it might be that it's more uncomfortable and therefore when you're in hospital you can have other pain relief other than paracetamol and ibuprofen.
You can give
can-
stronger stuff.
Yeah.
Great.
We don't just like leave people.
That's not all you get.
No, that's
Paracetamol, ibuprofen, hot water bottle? No, you will have more.
Don't think
more
you're even
pain
allowed hot water bottles in
You're
hospital.
not in hospital.
Oh,
Because you
Can you
might
take it
burn
dangerous?
yourself.
Can you have a heat pad?
Maybe, probably not.
Probably
check
not
with
a
the
bath
ward.
either.
No, we do have baths actually.
Yeah.
Yeah. You could have a bath, but not a hot water bottle.
I'm not sure it would be the same as a nice relaxing bath at home.
No, not the same.
No, not quite.
No.
So, surgical.
Yes.
What kind of surgery are we talking?
Okay.
So, well, essentially it's the same thing. There are slight differences in some of the things that we can do.
Okay.
So we're putting a tube into your womb. So it goes 3 vagina, 3 cervix into your womb, and we're using suction to remove the pregnancy.
Okay.
That's the most kind of simple way to
Like
explain it.
vacuuming it out.
Yeah, like that. There are slightly different ways we can do it. So you can be awake. So something called manual vacuum aspiration, or MVA, because we like to
Shorten things,
Yeah.
make it more confusing, that's fine.
that you can be awake for, but with pain relief. So you can
Okay.
use gas and air. You can have what's called a cervical block, so local anaesthetic into the neck of the womb, like when you go to the dentist, but into your cervix. And many women tolerate that really well. And the benefit of that is that you're not under anaesthetic, so you don't have the risks of a general anaesthetic, and also you can, get up and mobilise and go home a bit quicker.
Yeah.
That you tend to need to be an earlier gestation, so earlier in the pregnancy. I was going to say younger in the pregnancy, earlier in the pregnancy, rather than later, just because there's a kind of size limit with the manual vacuum aspirator. And then the other thing is you're asleep under general anaesthetic with a similar procedure, but we can do that up to slightly later gestations because the device is slightly bigger.
And does that go up to 24 weeks?
It would be different.
Yeah,
at 24
different.
weeks. Because if you think at 24 weeks you've got an actual fully grown baby.
So is it a different type of surgery?
Yeah, it's a destructive surgery. So we would dilate the cervix up and remove the pregnancy that way with kind of forceps.
It's just that's the only way it can be done if you're having a surgical termination at that point. If it's small enough, we would use the vacuum. If the pregnancy is big enough, is too big, and we can't use the vacuum, the only way is to remove it sort of with instruments. Yeah.
And we would give you the medications that you would have had if you were having medical just before you come through to surgery,
to
try and
because we
promote
want to make the cervix a bit softer and easier to get in. Because if you've not had a baby before and your cervix is really tight closed, and we want to put something through it that's kind of 16 millimeters, it really needs to open, and we don't want to be traumatic to the cervix. So we need to do that as gently as possible. So giving you some medications first can make the process easier.
So if it's suitable for them, you would most suggest people to have the medical?
Well, it depends.
It's a personal choice.
Like,
It's not just the risks and the complications. It's actually also your family life. Like you might have like 5 kids. You might have one day that you need to come into hospital and get this done, and not be at home bleeding for potentially,
Whilst
bleeding
looking
heavily while
after
you're looking after your
children.
children.
Yeah.
Everyone's circumstances are different, and you have both choices, but it's important for you to know the risks and the benefits of each and make your own decision, basically.
No, I totally agree. And if it comes down to like what I would choose, it might be different to what somebody else would choose. And I think that's a good thing, because you're allowed to have choice. As long as you know the risks and the benefits of both, then choice is a good thing.
Yeah, you just need to know what you're choosing, so you need to know everything about each of the options.
Yeah. And complications after surgery. So you can have bleeding, infection, injury to surrounding structures when you have surgery, because you can perforate the womb. This is a blind procedure on the whole, so we're doing it by feel. So we're putting instruments into the womb to remove a pregnancy, but sometimes, because the womb is really very soft when you're pregnant, we can go through the womb and you can cause damage outside of the womb. It's very rare to happen, but it can happen. So people would be warned about that. And, we were saying about being really very careful with the cervix, because we wanted to open it but not kind of damage it. You can get damage to the cervix through trying to open it. And again, we said about with the medical management, sometimes with the surgical management, you would carry on with a pregnancy or have some pregnancy tissue remaining.
Okay.
With the best will in the world, we try to remove the pregnancy tissue. And some people scan afterwards, but even when you scan afterwards, it can look like you've removed everything, or it can look like there's blood clot. And blood clot and pregnancy tissue can look the same. And it's really difficult to work out if everything's removed. And mostly it is on feel, because when you've done a lot, you kind of know what you're doing. But it will fail in some people, and then they will go on to either need further surgical treatment, or sometimes people would try medical treatment at that time.
And you would know that because you're advised to do a pregnancy test to check that it's worked.
Yeah.
So if that pregnancy test is positive, then you would come back and have more treatment.
So there's some people that this wouldn't be appropriate for surgery. So you've got to think, we've said about having an anaesthetic.
Yeah.
So if you're having an anaesthetic, there's some people that just wouldn't be appropriate to have an anaesthetic. And especially for a procedure that we could maybe do without an anaesthetic, if you're going to see an anaesthetist, so that's a doctor that puts you to sleep, and they're like, do you know what, you're really high risk, you've got a heart condition or you're on various different medications, this is really not a good idea, then it might make people kind of rethink.
And then you might be someone that's more suitable to have it awake but with pain relief, so not be put to sleep, or have medical termination.
Yeah, so there's certain things to think of with regards to if you're having a surgery, just like any other surgeries, really. But yeah, I think that's kind of covering most of the surgery stuff that we wanted to talk about, was it?
So people listening, or you guys might have heard people talk about a DNC. Has that been something you've heard of?
Dilatation and something else.
So it stands for...
That's what I thought you were going with when you said dilatation before. I was like, oh, I know it's coming from.
I thought you said DMC,
it's linked to that.
Deep, meaningful chat.
No, this is a DMC.
Is a DMC.
I've never heard of
similar
DMC
to that.
as a deep, meaningful chat.
I love a DMC.
We all learned something new.
Well, you have now. That's actually using it. But yeah,
So D and C.
It is linked to that procedure because part of it is dilatation. So dilatation and curettage. So it is the way that it used to be done, where you would dilate the cervix and then essentially use a little metal tool that can scrape away the pregnancy.
Oh.
We don't do that now. We use suction, vacuum, aspiration, which is more effective. But some people still say DNC because it's a well-known term, and you know it's a way to terminate a pregnancy, so people still use it, but we don't tend to do that.
It's more effective, but also
anymore.
When we're curetting, so using something metal to scrape away a pregnancy, I feel like even when I'm saying it, it's like, oh,
I'm like cringing.
I know,
Like,
the words are not super
they're
nice.
not really nice at all, but you've got to think then that you're kind of taking away endometrium, the lining of the womb, that shouldn't be taken away. So it potentially could be very damaging. People can get something called Asherman's, where they have scarring in the womb. So we try and not do that and use a suction catheter instead.
Yeah. But you will hear people say DNC.
Go on.
You know, with the suction, I know you're saying you do it by feel, it's blind. But I am imagining like a wee Hoover going in. Do you have to get it in the right place, or is it just like into the womb and then
it goes into the womb? So you get feedback from it when it goes in. So you've dilated the cervix, you go in and you can instantly feel that there's kind of like pressure on the tip, and you go gently to as far as you can, and then you feel resistance, so you know that you're at the end of the womb. And then you would turn the suction on and gently twizzle it round.
So you can just go from like
So
the
do you
top,
go-
it doesn't matter where it's...
Well, then at the end you will kind of like
Have a
make
little
sure
go
that
around.
all of
okay.
Yeah, so when the womb is empty and you go in with your big plastic tube, essentially, it feels different to when there's a pregnancy in there.
Okay.
So there's a feeling that you
it's really random,
recognise.
but it feels really different. So at the beginning it feels quite like straight, like silky smooth.
Okay.
And then at the end it feels like gritty and you can't really move it. So then you know that the pregnancy's removed.
I was thinking, did you have to go in and like get it exactly on the right spot and like suction the
You
right
just have to
bit?
get it in and then twizzle it round so that
Okay.
it captures the pregnancy.
I feel like I've not even thought about it that much, but it is.
I think
it's
it's
quite
all
strange.
you do it, that's how you know how to do it.
Whereas
by
we're like,
practicing it.
what?
Yeah.
You do it without seeing it? Are you sure?
But you can feel it, and we do, lots of these for various different reasons.
Some people do scans as well during the procedure, and usually if it's a later gestation, you would scan at the same time.
There are definitely certain situations where you would scan. So if someone's also got, I suppose, quickly a uterine abnormality whereby they've got kind of two wombs, or they've got a misshapen, something like that, then you'd want to scan to make sure you've actually been in the bit that had the pregnancy. So there are certain situations where I would scan.
And we talked a bit about complications. So infections are one of the potential complications. With a surgical termination, we always give antibiotics because the risk of infection is higher.
Is it like a
with
just in
medical.
case antibiotic?
Yeah, so we usually give it during the procedure. And also there is, we'll talk about that a little bit later, but then we used to always give women antibiotics to treat for presumed sexually transmitted infections in termination. We don't always do that now
Feels like
because
quite
that
the
is wrong.
presumption.
But that's an opportunity to
be tested.
be tested and to get antibiotics if you need them.
When you said you give them during the procedure, do you mean like through a drip?
Through a drip, usually,
Okay.
yeah.
I didn't know whether you meant like giving them tablets during it. Just pop them in
If someone's asleep, you can usually give them something through a drip. It's much easier.
Much easier.
Force feeding them tablets.
Swallow. And with regards to pain relief, you would be offered pain relief again, because you are going to have some bleeding afterwards.
Yeah.
You're going to have a bit of cramping afterwards. That will be completely normal. Use pads, not tampons, again, as we said before. Sometimes if you've had an MVA, when you have an MVA, you would put local anaesthetic around the cervix. Okay. So that's to kind of give you a little block. That's only going to last for a certain amount of time, so you will need painkillers after that.
Yeah.
Okay.
Yeah.
Sorry.
I was going to say, is there anything else that you can't do for a while after? Like, can you not go swimming?
Well, while you're bleeding, that time I wouldn't go swimming. I usually say use pads, not tampons. No intercourse, no swimming until you've stopped bleeding this time.
Okay.
I feel like you're in a little swimming moment now.
I know. Just a query.
Just a query for all your swimming needs.
So once you've had a termination, what happens then? Are you just sent on your merry way?
Well, you might be at home as well, which you have to think about. So what
We've
do you do after
surgery,
that?
that's all I'm thinking about.
You're expecting bleeding, pain, and everything that we've talked about. You want to know if it's worked or not, so you should do a pregnancy test about 3 weeks after the termination to see if that's negative, then you know that that's been a success. If it's positive, then you'd need to contact your local unit.
Yeah.
As we mentioned, it's a good opportunity to think about: are you at risk of an STI? Do you need an STI screen? Do you have any symptoms that might need some treatment? So that's another really good opportunity to kind of optimise your health there at that point. And then also the other thing is the emotional side. So, it's difficult at any point for any reason for you to have a termination. So the other thing is the emotional side of things. So it can be a really difficult decision to make. It doesn't really matter how pregnant you are, what kind of termination you have, you will need some support. So you should get some support service through the unit that you've been to, but you may also need some additional counselling. You may need to think about talking to your friends and family and your partner if you have one. And just really look after yourself, because it's not just an easy thing because you don't want to be pregnant. It's still a physical thing to go through.
I think, and from speaking to fertility patients and speaking to friends and various different people, terminations actually haunt people. Because they think it was the right thing to do, but then they're always thinking, but what will it impact? What will happen? So talking about it and ensuring that, I'm always kind of saying to people, I'm just like, but it was the wrong time. It doesn't matter that you've had that termination. It was the wrong time for you to be pregnant, and you made the decision that was right for you at that time. And I think it doesn't matter if you were coerced into a pregnancy, or it was domestic violence, or if you were raped, or you're still going to have, there are repercussions, headspace kind of repercussions from having a termination, and these should not be underestimated.
I think there's a lot more things that go into it than people think. People in general would just be like, oh, that's it, you've just got rid of what was your pregnancy, move on. But there's
it's
a
not
lot
like that, is it?
more involved.
No, it's still grief, it's still a loss, because even if you didn't want to be pregnant and termination was the right decision for you, as Nick said, you might still have a lot of emotions around that, and you might still think, had I been in the right situation, that could have been a baby, and that is a very upsetting thing to go through. So it doesn't matter how many weeks you are, what the reason for your termination is, it can be upsetting for everyone, and we should be sympathetic to that.
Definitely.
Equally, it might not be upsetting, and that's okay too. But it is something to be sensitive about.
And is there anything else that's discussed and taken into account after a termination?
We briefly, I think, chatted about it before, but contraception.
Yes.
So it's difficult because we've just said everybody is going to be in different headspaces, and it's going to be a very strange conversation to have for some people when they're kind of like, I don't want to talk about this, I've just had a termination. But actually it's really important, because termination is not a form of contraception, and anybody can need a termination for different reasons at different points in their life, but they should access contraception if they're not wanting to be pregnant and they're sexually active. So this is a good opportunity to discuss, hopefully as gently as possible, kind of thoughts about contraception. And it's a good opportunity for us to kind of assist with long-acting reversible contraceptive if you're in hospital.
It's a good opportunity to actually get good contraception. You might have been thinking, oh, like Makita Oliver. She wanted a coil but didn't get one, had a termination, and then was able to get a coil because you're actually in the service. You might be having a surgical termination. Someone's already going into your womb with an instrument. If you wanted a coil, you can get one straight away.
That was going to be my next question, because I know sometimes when people have given birth, they get their contraception.
Yeah, you can have it straight away, and same with an implant. If you're under a general anaesthetic,
just pop it in.
And you want an implant, that's a great opportunity because you won't have to feel it going in.
What about if you got given a coil, but then there was complications and you hadn't got all of the pregnancy tissue out?
We could just remove it and then remove the
redo
pregnancy
it.
that's left.
Yeah, okay.
So I would prefer you had the coil than not had the coil, thinking about, well, what if there is a complication? I'll have a coil later. That later...
Are you going to come back?
Yeah.
Are you going to actually do it?
It's a real good opportunity to get contraception. And even just have a chat about it if you're not sure about what you want. Yeah, you're there with doctors, nurses who can give you really good information about the types of contraception that are there.
Yeah, I think it's a good idea to do that. And we chatted a bit before about kind of complications. So bleeding was one of them, and you needed to seek medical attention if you had heavy bleeding. The other thing is if you've got a funny smelling discharge, then see somebody. You might have an infection. If you've got, especially kind of if you've got a temperature, flu-like symptoms, just seek medical help. If you've got worsening pain, there could have been that there was a perforation that we've not realised. So like if you have any issues that you're worried about, then see somebody. You will have been given this information. So go back to the kind of guidelines that you were given, or the QR code or whatever you were given, and have a quick look about who they said to be in touch with. On the flip side of that, if you've had a tiny bit of spotting or no bleeding whatsoever after a medical termination, then it's probably not worked. So again, you need to seek medical attention.
That's what they're there for, isn't it? So once people have had a termination, would they require any follow-up? Is there like a come back to us in X amount of time?
Usually not. So if we're talking kind of the more straightforward, lower gestation, it's been successful. Most people say you're having medical termination, you might have seen the pregnancy pass, or you might have had the heavy bleeding that then gets lighter. That's a sign that it's been successful. If you've had surgical termination, obviously we will see it when we're removing it. You should do a pregnancy test in about 2 to 3 weeks, usually about 3 weeks, to make sure that that hormone is negative, which tells you that all of the pregnancy tissue has been removed. If it's positive, then that would be a reason to get in touch with your local unit again. And the other thing would be if you were still feeling kind of pregnant, that is another thing that might prompt you to go and get medical advice or do a pregnancy test and see if it has been successful. But there's no routine follow-up that you need.
It's not like we need to see in 6 months to make sure everything's okay.
No. Do you think that's everything that we wanted to cover?
I think it is.
I think
that was really interesting. I feel like I've learned a lot.
Yeah, I've definitely.
There's a lot of similarities with management of miscarriage as well, which is, we've done another episode on management of miscarriage. I can't remember what we called it. Miscarriage Matters. Which there's a lot of parallels in the surgical and the medical treatment. So maybe it feels like we've talked about this before. Because we kind of have.
Just from a different
but in a completely different perspective.
Different perspective, different time of life, different kind of situation that people could be in. And I think it is just that kind of people should be sympathetic, empathetic to people when it's not the right time.
And there should be no shame in having a termination. You don't need to feel ashamed for going and accessing a termination because you might have made the right decision for you.
You can see how people do with a lot of the politics that's going on.
Yeah, it's awful.
I think we still have a few questions that we haven't actually touched on yet.
Okay.
You going first, Elle?
I will do. So, will having a termination when I'm young affect my future pregnancies?
No, it will not. So don't hesitate if you're pregnant and it's not the right time for you or it's not safe for you. It will not impact your future pregnancies. It's safe to have one.
Okay, next one. Can I take time off work or school if I need to have an abortion?
Yes.
Definitely.
We'd
Please
encourage.
do.
Good.
And you don't have to tell them what it is for. So if you feel comfortable, then tell them it's a termination. I'm going to need 3 weeks off or however long. But you don't have to tell them that you're having a termination. You can say it's a medical procedure and I don't want to tell you what it is. It's completely up to you.
But please take time for yourself, like both physically and mentally. Make sure that you're in the right headspace to go back to work.
Yeah.
Is a termination bad for my general health?
No. Probably carrying on with a pregnancy that you don't want to have would be very bad for your mental and physical health. Obviously there are some, it's not a straightforward walk in the park. Sometimes there can be complications. Even when it goes straight forward, it can be painful, you can bleed heavily. But if you want a termination and you're accessing
the right care for it that's better for you than continuing with a pregnancy that you don't want.
Yeah. Great. So I think we're now on to myths.
Yeah.
Okay.
And this one is a bit niche. Abortion increases the risk of breast cancer.
Yeah, no, it doesn't.
No, where has that come from?
I've no idea,
I've
but like
seen
that
these
is what
online,
we saw
I've
online.
seen that as well, yeah.
It's not to
I
do
think
with
it's to do with the
mifepristone.
medications, and you're just like, no. Like, it's just like one off dose.
one dose.
Of anti-progesterone. Like, no.
No.
But yeah,
definitely
I guess
not.
the link there is that potentially because some contraceptives have an increased risk of breast cancer, but again, that's taking it
For a
regularly
long
every day.
time.
Yeah.
And this is a one-off dose, and it's much better
So
to not be
should
pregnant when you don't want to be.
Yeah.
That's strange.
These myths we've definitely addressed, that abortion is only for people who are careless or irresponsible, or that you should feel shameful afterwards.
Definitely not.
No,
Absolutely not.
Definitely not.
No.
Then again, one that we've sort of touched on, abortion is a form of birth control.
Yes,
We're not
definitely
fans of that.
Well, I am, if you would like an abortion because it's the wrong time for pregnancy or any of the other reasons that we've discussed today, please access abortion services.
Get it.
But please access contraceptive services above abortion services, and do not use abortion services as a form of contraception because it's just not needed, and your body doesn't need to go through that. Your brain doesn't need to go through that.
No.
So much stuff doesn't need to go through that
No.
when you can access free contraception.
I'm not sure about the science behind this. Medical abortion drugs make the body reabsorb the pregnancy.
No, not true. No. There's no science behind that. That doesn't happen.
I suppose like taking it slightly laterally, if you take methotrexate for an ectopic pregnancy, then you wouldn't pass a pregnancy.
No.
As
Okay.
such. So if the pregnancy's in the tube, it's really small. We sometimes give a drug called methotrexate, which stops a pregnancy from dividing and getting bigger, and kind of just stops the pregnancy from developing. And you wouldn't then pass a pregnancy. The pregnancy, in a sense, would be reabsorbed. But
that's very lateral.
But that's
'cause it's
very lateral
not
thinking,
a termination.
and it's
Yeah.
not a termination.
Yeah.
Maybe that's.
But we
where
like a
it
bit
got
of
from.
lateral thinking.
Yeah,
We have to
okay.
do sometimes.
I'll go with lateral.
And then this one's really interesting. People will be able to tell if I've had an abortion, even if I don't tell them.
No.
No.
They might notice. So in the immediate, if
As
you're
soon
off
as she
work,
said that, I was like,
no one can. You can't look at someone and be like, "I know that she's had 3 abortions.
Yeah.
One in 2017."
Yeah.
There's no way.
Oh my god, do you know the dates?
But you know, if you don't want people to know around you, and you're going to be having a termination, you are going to be not feeling great for a few weeks
Yeah.
potentially. So you might want to give them a reason for that, like, "Oh, I'm going on holiday. See you. I'm not going to be around." You know.
Yeah.
But they might notice that. Yeah.
But you wouldn't.
But they won't just be able to know.
It won't be
No.
written on your forehead.
Yeah.
No, definitely not.
Yeah, that's everything.
That's
Right.
us.
Fab. I think we've done a great roundup there of termination.
I think
think
so.
we have.
Definitely.
Yeah,
learned
it's
a
a
lot
really interesting
there.
topic, isn't it? Because actually it's very, very straightforward, but all the politics makes it very
Murky.
controversial, murky, and I'm so glad that I don't live in America, and it's just so unfortunate that has happened, and it's going to take it's going to take a lot of work to undo what Donald Trump
I was
has
going to
done.
say, to get back to
Yeah.
where they were.
Yeah, to
Like,
get back to
it's just
2024.
Crazy.
Very backwards.
Mental.
ridiculous.
So,
Anyway.
just a little disclaimer. So everything that we have discussed are our own opinions. They shouldn't be taken as personal medical advice, and they should not be affiliated with where we work.
Yeah, if you've enjoyed this episode, if you've learned something new, make sure you leave us a review wherever you get your podcasts.
Might seem like a little thing, but giving us a 5-star review pushes the podcast out to as many people as possible. We really want to break down barriers, bust myths, and give out really good information.
And we want this episode and the whole podcast to reach as many people as possible. So if you'd like to be part of that ripple effect, then please hit the like button.
And make sure you're following us on all platforms at Between Two Ovaries and engaging with our content.
Thank you.